Hello guys, welcome back to my channel Universal Analyzer. In this video, we are going to cover one of the important topic in the anatomy which is also asked frequently in the university exams. It may be asked for the 10 marks or it may be asked for the 5 marks. If asked, then how to represent the answer in the answer sheet. Breast anatomy is covered under total 2 videos, whereas in this video we are going to cover the situation, extent of the base, deep relation and the structure of the breast. Whereas in the next video we are going to cover the blood supply, nerve supply, lymphatic drainage and the clinical anatomy of the breast. Here first of all we have to write the situation where it says that the breast lies in the superficial fascia of the pectoralis region. Pectoralis region almost covers the anterior part, that is the chest area, where the pectoralis superficial fascia will be there, whereas breast have been divided as 4 quadrants. They are named as upper medial, upper lateral, lower medial and lower lateral. If we will divide here, it will be the upper, it will be the lower and this will be the lateral side, this will be the medial side. In this way, the 4 quadrants have been divided. And the upper lateral part, here the upper lateral part, the extension of this part is known as the axillary tail of Spence, which passes through the opening known as the foramen of Langerhans. This is the situation. Now, next to that is the extent. Extent we can see vertically and horizontally. Vertically, it extends from 2nd rib to the 6th rib. Here, 2nd rib will be there, and up to the 6th rib, the extent of the breast will be there vertically, and horizontally we can say that lateral border of the sternum and the mid-axillary line. In this way, we can write or we can explain the extent of the breast. Now, the third point that we have to write or the third heading that we have to remember is that the deep relation. How we will explain the deep relation of the breast? That it lies on the deep fascia, pectoralis fascia, covering pectoralis major muscle. It lies on the deep fascia. On the deep fascia, it lies. That this word we have to remember. Deeper part will be pectoralis major, serratus anterior, and external oblique muscle of the abdomen. This is one of the neat question, or it may be asked in the MCQ of our university exam. Here, pectoralis minor is not the deeper part of the breast. That one point we have to remember for the exam. It may be asked in the MCQ form. Now, one more point that we have to remember in the deep relation is that retromammary space. What is the retromammary space? It is this breast is separated from pectoralis fascia by loose areolar tissue which is called as the retromammary space. Here, breast is there and next to that will be the pectoralis fascia. Here pectoralis muscle is there. Covering to that pectoralis muscle is a pectoralis fascia, and the space between this is known as the retromammary space. Next heading that we have to remember is the structure. For structure, we can write the subheadings like skin, parenchyma, stroma. First of all, first point will be the skin. First of all, conical projection, that will be the nipple, which presents below the center of the breast. Fourth, intercostal space 10 cm from the midline. It has a few modified sebaceous and the sweat glands. And nipple is rich in nerve supply. Next to that, the subheading in the skin will be the areola. One is the nipple, second is the areola. Areola, it is a skin surrounding the base of the nipple, is pigmented and form a circular area called as areola. It is rich in modified sebaceous gland and devoid of hairs. the next subheading that we have is that parenchyma under the structure. Parenchyma, it is a compound tubuloareolar gland which secretes milk. The gland consists of 15 to 20 lobes. How these glands have been formed? It consists of the 15 to 20 lobes. These are the major lobes. 15 to 20 in number they will be. Each lobe, it is a cluster of these alveoli. Small alveoli will be there, and then lactiferous ducts will be there which converge into the nipple. Each lobe consists of the cluster of the alveoli will be there. Then lactiferous sinus duct, and then to that will be the nipple. In this way the milk drains. Now the next subheading is that stroma. The fibrous stroma forms septa, which is known as sensory ligament of Cooper. It forms supporting framework of the gland. We have covered the 4 major headings of the breast. In structure of the breast, the subheadings will be skin, parenchyma and stroma. In skin, we have to write 2 points, that is about the nipple and about the areola. And in parenchyma, we have to write about the lobes, lactiferous ducts, lactiferous sinus and then the nipple. And in stroma, the sensory ligament of Cooper, 1 point that we have to remember. In this way, we have studied some of the headings and the blood supply, nerve supply, lymphatic drainage and the clinical anatomy we will be discussing in the next video. If you like the video, please hit the like button and subscribe our channel. Thank you.